Today marks 3 years since Russia's invasion of Ukraine, and according to the United Nations, at least 12,000 Ukrainians have been killed. There is widespread displacement as well. To get a better idea of the ongoing situation, we're joined now by a Chicago-based doctor who is currently on the ground in Ukraine, Dr. Olga Maihutiak. She is the Ukraine Health Programs Coordinator with the medical nonprofit MedGlobal. So, Doctor, thank you so much for joining us this morning.
Good morning. Thank you so much for having me today.
Can you first sort of describe for us just what MedGlobal is and where you are in Ukraine right now?
Sure. MedGlobal is a nonprofit organization that focuses on medical emergencies and medical healthcare responses in various countries, and part of those countries is Ukraine. And I am currently in Western Ukraine. I got here 2 days ago, so I'll be spending some time talking to physicians, visiting hospitals, and talking to medical universities that we work with as well.
I understand you haven't been on the ground long yet, but have there been any moments that have stood out to you so far, just in terms of what the Ukrainian people are really dealing with amidst this ongoing war?
You know, since the beginning of full-scale invasion, Russia has made over 2,000 attacks on healthcare system in Ukraine. That includes hospitals, maternity centers, ambulances, and healthcare workers. And one of such hospitals was Ahmedid Children's Hospital in Kyiv that was attacked just last summer. And that hospital treats children with rare and oncological diseases. And at the time of the attack, there were 630 children being treated at the hospital. And those attacks continue happening daily. So it has, and that limits the access to healthcare. You know, people also, when we talk about frontline areas, the infrastructure has been completely destroyed in many places, so there is no access to basic healthcare. And we as MedGlobal know that because we have mobile clinics operating in such prefrontal areas. And we see anywhere between, just last year, we consulted over 3,500 patients. And those are the patients that otherwise would not be able to get any healthcare services at all. Just imagine having an emergency and not being able to call anywhere because, number one, there's constant shelling in those areas. There are no hospitals because they've been destroyed. And a lot of healthcare workers have moved to western part of Ukraine or abroad. And I'm also hearing there's a huge shortage of nurses in these areas as well, not just prefrontal areas, but in Ukraine as a country, because a lot of them have moved to European countries. As a nurse, it's easier for you to practice, it's easier to get a job in European country versus for a doctor. So we're seeing a very tragic situation right now.
Doctor, I really want to spend more time talking to you, but unfortunately we are already out of time. Can you answer for me really briefly, though, where those 630 children went? I mean, where were they placed after that hospital was destroyed? If you can answer that really quickly.
So the hospital was not fully destroyed. It was attacked. It suffered some injuries. Children safely were evacuated outside and then taken to hospitals nearby. And then MedGlobal was able to also assist Ahmedid Hospital with some medical supplies. And as of today, as of a few weeks ago, we've heard that the hospital is fully operational at the moment. So this shows the resilience of Ukrainian people because they continue staying strong, fighting, and continuing their lives.
Dr. Olga Maihutiak from MedGlobal's Ukraine Health Programs Coordinator, thank you so much for being with us this morning. We really appreciate your time and your expertise.